about common pulmonary issues in children. So just jump right in. So tonight, although there are many pulmonary topics that we could discuss for the sake of time, I picked some of the more common topics that parents come to see me about. So asthma, we'll start with that, and then I'll talk a little about croup as well as bronchiolitis, and then just chronic cough in general. And then I'd be more than happy to take some general questions. So, what is asthma? Asthma is actually one of the most common chronic conditions in children. It affects um, more than 6.5% of all children in the United States. So, that's a lot of children. And it is a chronic lung disease that causes inflammation in the airways that leads to swelling and narrowing. And then that leads to asthma symptoms, which I'm going to get to in a minute. So, a common question I get is what causes asthma? Why did my child get asthma? So, the truth is, we don't know what the exact cause of asthma is, but we do know some things. We know that there can be a genetic predisposition to having asthma, meaning that if there's a family history of asthma, specifically if a first degree relative, like a parent or a sibling, has asthma, your child is more likely to develop asthma. Also, if your child themselves has another, what we call atopic disease, like eczema or allergies, they are genetically more likely to have asthma. Um, and then we also know that environmental exposures can increase the risk of asthma. Um, specifically things like secondhand smoke. Um, so those are just some of the causes that we know that cause asthma. So next I'll talk about what are the signs and symptoms of asthma. So coughing is the number one sign, which can sometimes be confusing. Sometimes kids with asthma can just have cough and not have other symptoms. Um, Asthma tends to be worse at night. It will wake a child up from sleep, or a parent will be up all night listening to their child coughing. It can wake a child earlier in the morning than they would normally get up. That's pretty classic for asthma. It can also vary with the season, specifically if your child has allergies, say to pollen in the spring, their asthma might get worse and they might have more coughing episodes. Um, and it can be dry or have some sputum, meaning it's wet. Um, Wheezing is another common symptom of asthma, although parents don't always hear wheezing. You might have a provider tell you that your child's wheezing. When their asthma is more severe after running around, sometimes people will say, I hear my child wheezing after they've been exerting themselves. And it's kind of a high pitched melodic sound, specifically when they breathe out or expire. When they're breathing out their air, it's hard for them to breathe out their air because of that narrowing and swelling that I mentioned. Um, Older kids might mention that they feel short of breath or their chest is tight. And a very common symptom of asthma is exercise intolerance. So in little kids, they're not stopping themselves from running around, but they're having heavier breathing or coughing, or you might notice that they don't seem to keep up with their peers in the same way. In older kids, they might say, I have to stop what I'm doing. My chest feels tight. So the symptoms can change depending on the age of the child, but exercise-induced symptoms are pretty common in asthma that's not well controlled. And asthma can also just be exercise-induced. There's a whole spectrum of what asthma looks like. So the next important thing to talk about when we talk about asthma is asthma triggers. So, one of the most common asthma triggers is a viral upper respiratory infection, which is just a fancy way to say a common cold. So, unfortunately, in children who have asthma, when they get a common cold, their asthma tends to flare up and they can have more difficulty managing that cold compared to another child who doesn't have asthma. Um, Also, things like sinus infection, sinusitis, or pneumonia, and bacterial or viral infection in the lung can also cause asthma to flare. Exercise, as I mentioned, is a big asthma trigger. Weather changes. So, cold weather tends to irritate the breathing tubes when you have asthma. So, you might notice that when the weather changes, back to school, not only are they getting the common cold, the cold weather is setting off their asthma. As I mentioned before, tobacco smoke is a big trigger for asthma, as well as what we call allergens. So that could be indoor allergens, that's like dust, pet dander, or outdoor allergens like grasses, pollens, weeds. Those can all be asthma triggers. So we try to see it to understand if your child has allergies, and then we can plan their asthma management better based off of these things. And also other irritants, people might complain about strong perfume smells or cleaning smells that trigger their asthma. So, what is the treatment for asthma? Well, the answer is it depends. Asthma is actually becoming more and more individualized, and it's important to work with your doctor to develop a treatment plan that works best for your child based off of their symptoms and their triggers, and understanding all of that and putting it together into a specialized plan for your child to make sure that we're treating their asthma in the best way. So the good news is we have lots and lots of different asthma medications that we can use, and that when we find the right treatment plan, your child can live basically without even realizing that they have asthma. They will run around and they will exercise and they can do all the sports that they want to do, and everyone can get a good night's sleep. And so that's the goal, to identify what the correct plan is for your child. So in general, there's two big classes of medicines that we use for asthma. So I'll just talk briefly about that. So you can see here a picture of that breathing tube that I was talking about. And the first one is the normal airway, meaning it's asthma is not bothering it. It's nice and open. And then the other one is show to the right is showing an asthmatic airway that has inflammation, mucus, swelling. And what happens is it irritates those muscles around that breathing tube, that causes that coughing, wheezing, and all of those symptoms. So the first medicine that we use is the long-term controller medicine. So that is a medication that we generally give every day. Sometimes we use it a little differently, but it works to reduce that inflammation over time in the breathing tube to keep that inflammation at bay. So even if they are exposed to an allergen or, to a cold, because we can't prevent all the colds, we can keep their airway nice and open. And then if they do get sick or have a flare, we use the quick reliever medicine, commonly albuterol or something like that, to help alleviate the symptoms at the time that they're feeling sick. So those are in general the two classes of medicines that we use. The other thing that's unique about asthma is that how we're giving the medicines, it's not just a pill or a liquid to take. So your child might have a pump, and it's important to use a spacer when you have a pump because it helps deliver the medication more easily. And that's the picture to the left. Or in younger children, sometimes we use a nebulizer machine with a mask if they're not able to use the spacer and the pump. Another important piece with asthma management is developing what we call an asthma action plan. So, what is the plan? What medicines do we need to take on a regular basis? What do we do if our child gets sick? And we work together with families to develop an asthma action plan. And then, if you have a child who has asthma and they're in school, you know that the nurse is asking for this as well, so that they know what to do in case your child gets sick when they're out of the house at school. So we work with families to make sure that they have a specific plan in place in case their child gets sick. Another important part about managing asthma is identifying the triggers, like I reviewed before, and then reducing those exposures to the best of your ability. So if there's some indoor allergens, like say dust, then an air purifier or mattress covers or things like that can be helpful. Or outdoor allergens, managing their allergies to pollen. Even the first step might be identifying that they have an allergy and getting allergy testing done. And then also reducing environmental exposures like tobacco smoke, or other things like that. Sometimes it might be that your child's not in the room when you're vacuuming or when you're using certain cleaning products. So we work together to identify what those triggers might be and then helping to avoid those triggers to prevent an asthma flare up. Okay, so the next topic that I'll touch on is croup. So croup is another common childhood illness. It is due to inflammation in the upper airway. We were just talking about the lower airway where the lungs are, and now we're talking about the upper airway. So it's called the larynx and the trachea, and you can see to the right here where that inflammation happens, and it causes that upper airway tube to become narrow. And so, what are the signs and symptoms of croup? It's usually characterized by an inspiratory, what we call stridor, which is a high-pitched noise when breathing in, unlike wheezing, which is usually when breathing out. It might have a very barking cough. People say like it sounds like a seal coughing, or having hoarseness to their voice. And symptoms usually are worse at night. And it can also be worse when your child is upset and crying because they're moving air more forcefully, or even when they're excited and running around. Um, so what causes croup? Again, number one cause is viruses, so common colds. So it might be something called parainfluenza or adenovirus or respiratory syncytial virus or RSV. These are all common cold viruses. And croup tends to occur in younger children, so in that 6 month to 3 years old age, because of the airway being smaller at this age. But it can occur in older children, and it's generally diagnosed by examining the child. Um, and sometimes croup can be recurrent, and then that's a point where usually referrals are made to a pediatric pulmonologist. So how is croup treated? So if it's mild croup, you know, cold air or moist air tends to help alleviate the symptoms. So running like a steam shower and sitting in the bathroom and letting that steam for about 10 minutes help. Cold airs, if it's the winter, opening a window or even going outside can be helpful. Classically, a child wakes up, sounds terrible, has croup, they go outside in the middle of the winter. By the time they get to the emergency room or urgent care, they're like, wow, they sound better. I swear they sounded so much worse before we left. And we believe you. It's just that the cold air probably helped them. Sometimes it can be more severe. And in those cases, what we call a systemic steroid, like a steroid that you take by mouth, might be needed to help decrease the swelling in the airways. Um, and in more severe cases, other breathing treatments that involve epinephrine that helps really quickly reduce that airway swelling might be used. So the next topic I'll talk about is bronchiolitis. This is another common issue in pediatrics. So again, ding, 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 caused by a viral infection. So we're in cold and flu season, so all of these are relevant. Um, it's most commonly caused by, again, the respiratory syncytial virus or RSV, which tends to be more present starting in like the fall, winter, all the way to the spring. And it usually starts off with common cold symptoms like runny nose, coughing, congestion, and then sometimes can progress. And it's that swelling and inflammation and mucus in the lower airways. We have these bronchioles at the end of our airways that can get inflamed and clogged with mucus. So who gets bronchiolitis? It's usually in children who are less than 2 years of age. Most cases, again, being in that younger age group due to that smaller airway size. So they're just more susceptible. Any swelling and mucus will have them cause to have more difficulty breathing. And what are the signs and symptoms of bronchiolitis? So again, can start off with just runny nose, stuffy. Sometimes they can have a mild fever, coughing. They might have some wheezing because of that airway narrowing from that inflammation. And usually those symptoms can be treated at home. Mild suctioning, giving over-the-counter medications for the fever. But sometimes it can get worse. It tends to get worse after a few days of illness. So it might be like, oh, they have a cold, and then all of a sudden one night they just look a lot worse. So reasons to go seek medical treatment would be if they have fast, shallow breathing, if their heartbeat is very fast, if they're retracting, meaning they're pulling, you can see belly breathing, or in their rib cages that they're breathing, if their nostrils are flaring in their nose. If they're not eating well, babies, tend to not be able to suck well when they're all congested, so they can get dehydrated. So that's a reason to be seen. They might just seem more irritable, or if they're having what we call apnea, which is pauses in their breathing for more than 15 seconds, or if they're turning blue. Any of those reasons would be you want to seek medical attention right away. So how do we treat bronchiolitis? Again, if it's mild, really supportive care, meaning, letting them rest, really making sure that they're hydrated. If they're old enough, you want small sips of water, or if they're a younger infant, making sure that they're getting their feeding, their formula or breast milk. And then just gentle suctioning can help relieve that congestion. When cases are moderate or severe, they may need admission to the hospital. It's actually the most common reason that babies are admitted to the hospital. And again, hydration is really important. So if they're not tolerating taking liquid by mouth, then they might need an IV to get hydrated. And then in some more severe cases, if they're having difficulty breathing, they might need some support with supplemental oxygen. And then lastly, what are some common causes of cough? So the common cold will cause a cough in any child, even healthy children. And that cough tends to stick around for about 7 to 10 days. Beyond that, that's an abnormal cough. Asthma, kids who have asthma, especially if it's not controlled, will have a cough that lingers after they have a common cold. So that could be a cause of cough. And then sometimes allergies can also cause coughing. So we define chronic cough as cough that lasts more than 4 weeks. And that's really when, okay, it's time to go see, a doctor, go see a specialist and see what's going on here. Do they have asthma? Do they have something else going on causing that chronic cough? So again, asthma is, one of the most common causes of coughing in children. And so when we can diagnose it, then we can treat it. And then that means that we can stop the cough. Um, and less common, but occurs for, chronic wet cough is something called protracted bacterial bronchitis. And that might require some antibiotics. And then sometimes there's just non-specific chronic cough. It's often post-infection, where the cough might linger for a little bit and then self-resolves. If it's not recurrent, then it's not a big deal. But if it's happening over and over again and really not going away, that's a point where you want to go get seen and evaluated and kind of find out what the root cause of the cough is so that it could be treated. So I'm just going to end with, you know, what are when do we want to go seek medical attention? Because that's a big question. I'm a parent. It can be anxiety provoking when your child is sick, especially when it comes to how they're breathing. So just to review, things that you are never, ever, ever wrong to go seek emergency treatment for is if your child is struggling to breathe or having shortness of breath. If they're having what we call like tight breathing, meaning they're having difficulty speaking, it seems like they're even having difficulty crying. Again, if they're pulling in their ribs, those retractions that I mentioned before, any noisy breathing, we mentioned the wheezing, which is when you exhale, or stridor, which is when you try to inhale and you have that very noisy breathing. If they're breathing very fast, or obviously if they have any color changes like blue lips or in their face, you want to go right to the emergency room. Um, so with that, I'd be happy to take any questions.